Hello guys, welcome to today's session. This is your stern nurse. Today we will be discussing about IPSG, that is International Patient Safety Goals. There are total 6 goals. These goals are given by JCI, that is Joint Commission International. Certain peoples pronounce it as Joint Commission Internationally. It is an accreditation body which is in America and it gives the patient safety standards. So in order to prevent accidents and incidents occurring in the hospital, to avoid the negligence for the patient, these 6 goals were developed to improve patient safety in the most problematic healthcare setting areas with particular specific action so that these actions are performed and standard safety measures are being applied for the patients. These goals comes into action once your patient enters through the main gate of the hospitals, and throughout the loop of care it is there, and it gets over when the patient gets discharged. So during the whole stay of the patient from the admission to the discharge, all ever person handling the patient, no matter doctors, nurses, healthcare professional, pharmacist, or the janitor, the porter, everybody should know these goals and should carry out well in order to enhance the treatment of the patient, plus to avoid any kind of negligence or any mishappen to the patient, because any incident, it is only the patient who suffers. So today we will be seeing all the 6 goals one by one, their importance and what all are the actions to be performed while performing the patient safety goals one by one. So we will see each one today and the action. So first one is identify patient correctly. So you should always use 2 identifiers. The main 3 identifiers which we use is patient's full name, date of birth and UHID number. So full name should always consist of first name, the middle name and family or the surname which we call. Date of birth should always have the date, the month and the year of the person in which it is born. Then UHID is a particular unique hospital number which is given by the hospital to each person. It's like a seat number or the roll number you can call, and they never mix it together. If the patient is conscious, with the help of the ID band which contains a sticker which has all the relevant biographic data, you can ask the patient about it and you can correlate with the ID band. If the patient is unconscious, you can see it through any government approved identification card if it is present in the patient's document with that. If the patient is pediatric patient, cannot speak or verbalize, or is like mentally retarded, you can ask the accompanying caregiver or the next of the kin for the identification of the person. So you should identify the patient correctly while doing the surgical or the medical procedure, while administering medication, while taking handover, while giving handover, in order to avoid any miscommunication, cross confusion or any kind of accidents or incidents which can harm the patient and can lead to any sentinel events. Just to make sure correct treatment is being given to the correct patient, you should always carry out the identification of the person very correctly. Now let's move on to the second IPSG goal, that is improve effective communication. Communication is a core part and key component in any kind of work or activities which you do, which includes 2 or more person. So in a healthcare setting, the effective communication is carried out by closed loop communication. Closed loop communication means if sender is sending any message to the recipient should repeat the message to the sender. The sender should acknowledge the message and should give feedback whether the message is the same message, and then the action should be carried out. In healthcare setting, we avoid verbal communication and telephonic communication. All the orders or communication should be documented one, or it should be written. For example, the consultant cannot give any kind of prescription over the telephone or verbal orders. It should always be documented either electronically or through using the paper pen technique. The only exception is when you are handling code blue situation, that is the medical emergency situation. In that, the team, it always performs the verbal orders because it is set a series of action which is given by the AHA, that is American Heart Association. So that is the only exception which we follow for the verbal orders. Rather than that, the order should always be well documented. And if you're taking telephonic orders, tell the consultant to please come back and write it somewhere or document it, or either you can write it somewhere and please tell, and you can perform the medication, or you can administer the medication, you can perform the action, and then you can tell the doctor whether it is done properly or not, and then you can tell the doctor to come and just re-verify it or just check it. The third is improve the safety of high alert medications. The acronym is APINT, A for antimicrobial, especially the vancomycin and the gentamicin. You should be very careful because it has trough level. Second is potassium or other electrolytes. While administering electrolyte, you should check for the dose to be administered, the dilution, plus the time for which you will be administering. It should always be checked with 2 people. Then third, I is for insulin. You should always go for, if you are giving infusion through infusion, you should always hourly check the blood glucose level. N is for narcotics. Each country, each hospital has their own policies for the narcotic. The common thing is it is always kept in double lock system. And the key is certain times with 2 people, certain times it is 1 people, but the cupboard is always open in the presence of 2 people while checking the orders, and during the administration also 2 people are always there. Then C is for chemotherapy. Chemotherapy are a group of drugs which are administered during the medical and surgical management of the person who's having cancer. Then H is for heparin. Heparin is your anticoagulating agent. So it is most probably used during the thrombolytic treatment of stroke and MI and cardiac arrest. So depends on the consultant's order. It should always be administered in the supervision of 2 people. So for this APINT medications, these are all high alert medication. You should be very careful, and it should always be administered, prepared in the presence of 2 people. So this is the third. Now we'll move to the fourth one, that is ensure correct site, correct procedure, correct patient surgery. So in order to neglect or avoid any kind of miscommunication or a person getting operated on the wrong side, these are 3 things which the consultant or the surgeon should do it. First is correct site. So the site marking should always be done by the person who is performing the surgery, not by the assistant, not by the nurses, but the person who is going to perform the surgery, the primary surgeon. Next is correct procedure. So correct procedure should be performed on the correct patient. So for that, each time the person who is going to perform and the team should always rectify, recorrect, and the first IPSG goal, that is identify patient correctly, should always be performed while doing any kind of procedure, be it invasive, non-invasive, a short procedure or a long procedure. Then third is correct patient surgery. So correct patient surgery has 2 components, that is time out and sign out. Time out is performed just before the incision. So the circulatory nurse comes and takes all the identifiers of the patient, called the name, UHID number, the surgeon and everything, and then the whole team should approve it, and then only the surgeon proceeds with the first incision. Then when all the procedure is over, all the operational procedure is over, then the sign out is done. The sign out is done by the scrub nurse. The scrub nurse halts the surgery and they will count all the equipments, all the gauzes and everything, and then they will document. So this is the fourth. Now we will move on to the fifth, that is reduce the risk of healthcare associated infection. So in this 4 bundle comes, first is CLEPSI, second COTI, third VAE, and fourth is your SSI. So first is CLEPSI, that is central line associated bloodstream infection. So while administering any medication or a transfusion or taking out blood, the hub rub technique should always be used. And after the hub rub technique, if the medication is administered, normal saline flush 10 ml should always be administered with push and pause technique. Then second is your COTI. COTI is the catheter associated urinary tract infection. So while taking out or catching the urine sample, first of all the sterile technique should be applied while inserting the catheter, and then it should never be disconnected through the continuous thing. There are nowadays port coming in the Foley's catheter. You should always withdraw the urine sample from the port. There should never be any discontinuation of the whole connection. Then third is VAE. So VAE is divided into 2 parts, that is ventilator associated injury and ventilator associated pneumonia. It is not always seen that pneumonia occurs for the patient who is on ventilator. So that's why they have bifurcated as injury. If any barotrauma because of vigorous suctioning is occurring, so it comes under VAE. Next is SSI. So this is surgical site infection. So if the surgeon has not done the surgery properly and the dressing is not being done, and like aseptic technique is not developed, so the patient develops SSI. And in order to prevent all these things, the checklist is there, the bundles, and nurses fill it. The sixth is reduce the risk of patient harm resulting from fall. So after doing all the above 5 goals properly, but just like 2 minutes before getting discharged, if your patient is getting fall, the above 5 is of no use. So it is like a quality indicator of patient. If patient is getting fall, it is harm, and it comes under hospital, like the hospital is not getting well treatment of the patient. So in order to avoid these things, first of all, you should grade the patient as well as their vulnerability. So vulnerable patients are below 12 children, above 65 years old geriatric patient, women into active labors, then comatose patient who has previously fall, confused patient. So these comes under vulnerable patient. Then the room should always be lit. It should never be dark. Then caution boards, if sweeping and swapping are going on, wet floors are there, you should always put caution board. There should be anti-skid floors. It should not be marble or tiles floor. It should always have a carpet which is anti-skid. Good transportation equipment should be used. For example, if you're putting the patient on stretcher, secure it. Wheelchair, secure it. Do not let patient to walk alone. Always accompany the patient. You should always hold the patient, have the crane, walker. Even in the toilet, you should have the side bars for the patient to have a good grab if the patient is slipping or doing anything. Ask the patient to never lock the toilet doors. So these are all the things which you can do to prevent the patient from falling. Ask always a relative to accompany the patient. The patient should never be kept alone. So these are all the 6 goals, IPSG goals. In one session, it is very difficult to complete all the 6 goals. If any queries with any goals, you can comment in the chat box, and I will be telling you in deeper explanation about each goals. So these are the most probably IPSG 6 goals. It is carried out. It is a new intervention by JCI in order to prevent any incidents or accidents which can lead to harm of the patient. And so that's all for today. You can learn these 6 goals, understand them, understand the importance of them, and the actions to be carried out. And incidents do happen. It is all common with the human to perform incidents, but just because to safeguard yourself, do not hide it. Tell your superior or your other staff members, so that eventually whatever you are doing, it comes under somebody's life. So even if a mistake has, first of all, you should avoid doing mistakes. But if the mistake has happened, just rectify it. Tell to the other members. Maybe they can solve it before it becomes a big problem which is like unsolvable. So once you are in the hospital, make sure you carry out these goals, not because for the audit purpose, but in order to provide a good, compassionate, careful care to your patients who are in need of the care. And that's all for today. Have a nice day ahead. Bye bye. See you later.